Here at 6 tonight, a congressional hearing in Baltimore on ways to combat drug addiction and the opioid epidemic.
And ABC2's Mallory Safasi sat in on this hours-long meeting at Johns Hopkins Hospital today. And Mallory, what were the D.C. lawmakers up here for anyway?
They were here for a field hearing. Field hearings date back to the Civil War. These hearings bring Congress directly to the people and to the scene of a national issue. And right now, there is no bigger public health crisis in our country than the opioid epidemic, and maybe no place more fitting to have this field hearing than in a city embattled in the drug fight. The statistics are staggering.
The death toll from drug overdoses last year alone was higher than all U.S. military casualties in Vietnam and Iraq wars combined.
Today, drug overdoses kill more Americans than gun homicides and car crashes combined.
However you put it, opioids are killing a large number of people in our country. The CDC estimates 64,000 last year. More distressing than the numbers or the analogies is that these are family members, loved ones, dying, and somehow our country can't seem to ebb the body count.
We can put people on the moon and we can split atoms. Yet we're struggling with how to respond to this epidemic.
President Trump created a commission to come up with a series of solutions. The chairman, New Jersey Governor Chris Christie, laid out a number of recommendations in a report published earlier this month. The U.S. House Oversight and Government Reform Committee convened in Baltimore at Johns Hopkins Hospital to discuss the report and better diagnose the disease plaguing our nation, state, and cities.
So far this year, in our state, 1,180 people have died of overdoses in Maryland.
Of those deaths, nearly 850 were due to synthetic drugs, including fentanyl and carfentanil. Stopping the drug supply is one of the most critical of the 65 recommendations made by Christie.
We also need to make very clear to the Chinese that this is an act of war. You are sending this into our country to kill our people. There's no other purpose for this drug. This drug will kill people.
Second is medical education, requiring continuous training by medical professionals and encouraging them to prescribe alternatives to opioid painkillers.
And then lastly, we have underfunded treatment in this country, and we need to make treatment more available, folks. I think it was, as Member Cummings said in his remarks quoting the report, when 10.6% of the people who need treatment are getting treatment, we need to do better.
The committee also questioned Christie on funding and driving down costs for naloxone. Christie said it's now up to congressional leadership and the president to decide if, when, and how they want to implement this plan. In the meantime, someone in our country is dying every 20 minutes from an opioid overdose.